Hi, this is Cooper from GridSpace, and today I want to tell you a little bit about how our virtual voice agent Grace can do some really good work in the retention of participants in clinical trials, or really any study, uh, especially in the healthcare space where you want to maintain really good relationships with participants, make sure participants keep coming to their appointments, and really that nothing about that relationship falls through the cracks. Grace is really good at placing these kind of outbound proactive calls to check in on human beings because she can do it all the time. Maybe there wasn't the human power before to make these outbound proactive calls for participant retention and just checking in on people because people get busy, but Grace is free to do this all day and she's really pleasant to talk to. So first, I'll show you the kind of task we assign to Grace under circumstances like these. And then I'll do a little demo where I play the role of a clinical trial participant. Grace is checking in on me. So what we see here on screen first is the playbook. And this is basically the set of instructions or the loose framework that we give to Grace, the goals that we give her to achieve in this task. And so we have different pages here. We start with a greeting by Grace where she introduces herself and identifies who she's affiliated with, where she's calling from to give that context. Then we move through more of the conversation, and Grace ultimately collects information about how the trial participant has been doing, how they've been feeling, making sure everything's good there, and also giving them a chance to express anything that for whatever reason they have not expressed so far about their participation in the trial. Maybe it's a new issue, or maybe this participant hasn't felt comfortable expressing a need or a concern face to face. And Grace, as a non-human, as clever as she is very non-judgmental. So people often feel very comfortable sharing things that they might not have otherwise shared with Grace. So that's the job that we assign to Grace via the playbook. And now I will play the role of a clinical trial participant. And I've recently been in for a trial session at the clinic. And now Grace, maybe a couple hours up to a day or two later, is calling to check in on me. So here we go.
Hi, this is Grace with the Harper Hospital Clinical Trial. I'm a virtual clinician assistant, and I'm calling to check in and see how you've been doing. You have a minute or to the top right now?
Yeah, Grace, I remember you. I can talk right now.
Great, I'll keep this short. Your most recent session was on October 10th. Could you tell me how you've been feeling or how your health has been?
I say I've been feeling pretty neutral, not the best I've ever felt, but I'm not feeling any kind of bad.
Okay. All right. Now, I want you to know that I'm able to communicate with the trials organizers on your behalf. If there is anything about the study or your participation that you want to share, I will bring it to their attention. Is there anything you would like to say about the study or your participation in it?
Study's still going well, but I felt my kind of last session was really rushed, and that made me kind of anxious. So if we could just slow down the pace, I'd feel a lot better at my next session.
Thank you for your time today. And just as a reminder, your next clinic date is October 24th, but we'll send you the usual notification posted to that date. Have a great day.
All right, so that was a call with Grace in which I was the clinical trial participant. And Grace made sure that I was still aware of my upcoming trial date and asked me a few questions about how I've been doing and also solicited some feedback about my participation in the trial itself. And in combination, all of those things go a long way towards maintaining retention of participants within a trial because people don't feel like they've been forgotten about and people can voice concerns they have before those concerns become a problem that might really affect their willingness or ability to continue participating in the trial. All right, until next time.